Imagine Clara, a 28-year-old young woman, always full of energy and enthusiasm. She worked as a designer at an agency, loved sports, and had what she thought was a balanced diet. But in recent months, Clara started feeling strangely tired. She slept well but woke up exhausted, with no motivation for her morning runs or to go out with friends. Over time, in addition to fatigue, she began feeling tingling in her hands and feet, as if something was wrong, but she couldn't figure out what it was. If you want to boost your health with amazing tips, go ahead and like this video and subscribe to the channel. Here, you'll learn everything about vitamin B12 and how it can transform your health. Concerned, Clara decided to consult Dr. Gustavo, a trusted general practitioner. After describing her symptoms, Dr. Gustavo asked some questions about her diet and quickly suspected, "Clara, have you ever heard of vitamin B12 deficiency?" A bit surprised, she replied that she had, but believed her diet was sufficient. Dr. Gustavo explained that vitamin B12 is essential for the body's proper functioning, especially for nervous system health and red blood cell production. The symptoms you described, like extreme fatigue, tingling, and even some difficulty concentrating, are common signs of a deficiency in this vitamin. Curious, Clara asked, "But what exactly does vitamin B12 do?" The doctor explained that B12 is crucial for energy production in the body, as it helps convert food into fuel for cells. It also plays a critical role in DNA formation and maintaining the nervous system. Without adequate amounts of this vitamin, people may experience everything from chronic fatigue to neurological issues, like memory loss and balance problems. Dr. Gustavo recommended a blood test to check Clara's vitamin B12 levels. The results confirmed it. She was deficient. He explained that it's more common than people realize, especially among those following vegetarian or vegan diets, since vitamin B12 is primarily found in animal products like meat, eggs, and dairy. Clara was surprised, as she had cut back on meat without realizing this could be a related factor. The doctor suggested B12 supplementation, which could be done in various ways: oral supplements, periodic injections, or even dietary adjustments. If you go for supplementation, it's essential to ensure your body absorbs it correctly, since some people have absorption difficulties, he explained. Determined to regain her vitality, Clara began with injections, the fastest way to restore her levels. Over time, Clara started noticing significant improvement. That constant fatigue faded, the tingling became rare, and her work focus returned. It's amazing how a single vitamin can make such a difference, she thought. Besides feeling better, Clara began to value the importance of understanding what her body truly needs to function well. She continued her diet but now paid more attention to supplementation and included B12-rich foods, like fish and eggs. Clara also learned that, beyond improving energy and mental health, vitamin B12 offers other significant benefits. It helps prevent anemia, keeps the heart healthy, and can even aid in preventing depression and other mood disorders. Knowing this, she started encouraging friends and family to check their B12 levels, especially those who, like her, had shifted to more plant-based diets. Today, Clara feels more connected to her body and its needs and has become an advocate for proactive health care. If she could give advice to anyone, it would be, don't ignore the signs your body gives you. Sometimes fatigue isn't just stress. It might be something you need to adjust in your nutrition. Vitamin B12, also known as cobalamin, is one of the most essential vitamins for the healthy functioning of the body. It plays critical roles in red blood cell production, nervous system health, and DNA synthesis. Unlike some vitamins, B12 is not naturally produced by the human body and must be obtained exclusively through diet or supplements. Now, let's explore every detail about this vitamin: its functions, benefits, deficiency symptoms, forms of replenishment, and who is most susceptible to lacking it. What is vitamin B12? Vitamin B12 belongs to the B-complex family, a group essential for energy metabolism. Among them all, B12 is particularly important due to its vital functions in the body. It is a water-soluble vitamin, meaning the body cannot store it in large quantities. However, surprisingly, it is one of the few vitamins that the body can store long-term in the liver, using it as needed. This is different from other B-complex vitamins, which require constant replenishment. This vitamin is unique because it contains cobalt, which gives rise to its chemical name, cobalamin. There are different forms of vitamin B12, such as cyanocobalamin, methylcobalamin, hydroxycobalamin, and adenosylcobalamin. The two forms most utilized by the body are methylcobalamin and adenosylcobalamin. Functions of vitamin B12. B12 is necessary for several crucial processes in the human body. Here are the main ones. Function 1. Red blood cell production, erythrocytes. Vitamin B12 is vital for forming red blood cells, which are responsible for carrying oxygen throughout the body. Without B12, red blood cells develop abnormally, becoming large and unable to function properly, resulting in a specific type of anemia known as megaloblastic anemia. Function 2. Nervous system health. It maintains healthy nerve cells, ensuring the central nervous system functions properly. B12 helps form the myelin sheath, a substance that protects and insulates nerves, allowing electrical signals to travel quickly between them. B12 deficiency can cause nerve damage, resulting in tingling, loss of coordination, and even cognitive problems. Function 3. DNA synthesis. Vitamin B12 is involved in the synthesis and regulation of DNA, the genetic material present in all cells. This process is crucial for cell division and proper tissue growth. Function 4. Homocysteine metabolism. High levels of homocysteine, an amino acid in the blood, are associated with a higher risk of heart disease. Vitamin B12, along with folate, B9, and B6, helps regulate homocysteine levels by converting it into other beneficial substances, thus preventing cardiovascular diseases. What is homocysteine? Homocysteine is an amino acid naturally produced by the body during the metabolism of methionine, another amino acid found in protein-rich foods. At normal levels, homocysteine is essential for various bodily functions. However, when its levels rise in the blood, a condition called hyperhomocysteinemia, it can become a risk factor for several health conditions, primarily cardiovascular diseases like heart attacks and strokes. The body usually keeps homocysteine in check with the help of certain vitamins, such as B12, B6, and folate, B9. These vitamins help convert homocysteine into other beneficial substances, such as glutathione, an antioxidant, and methionine, important for protein synthesis. High levels of homocysteine in the blood are linked to artery hardening, atherosclerosis, an increased risk of blood clots, and blood vessel inflammation. To control its levels, a diet rich in B-complex vitamins is essential, along with regular medical monitoring for those at higher risk. Benefits of vitamin B12. When consumed at adequate levels, vitamin B12 brings numerous health benefits. Benefit 1. Anemia prevention. By promoting the production of healthy red blood cells, B12 helps prevent anemia, which causes symptoms like fatigue, weakness, and shortness of breath. Benefit 2. Energy boost. Many people report an increase in energy after supplementing with vitamin B12, as it aids in energy metabolism, allowing the body to better utilize nutrients. Benefit 3. Cognitive function maintenance. Studies suggest that maintaining good B12 levels can help protect against memory loss and other symptoms of cognitive decline. B12 deficiency can be mistaken for dementia since symptoms include mental confusion and memory loss. Benefit 4. Cardiovascular health. By keeping blood homocysteine levels low, B12 helps reduce the risk of heart disease. Benefit 5. Mental health. B12 has been associated with improved mood, and low levels of it may be linked to depressive symptoms. Supplementation can help in treating mood disorders in people with the deficiency. Vitamin B12 deficiency. Symptoms and causes. Vitamin B12 deficiency is more common than many people realize, and its symptoms can be severe if left untreated. The signs include: Symptom 1. Fatigue and weakness. The most common symptom of B12 deficiency is extreme tiredness, which can occur even after a good night's sleep. Symptom 2. Neurological problems, tingling sensations in the hands and feet, loss of balance, motor coordination issues, and even mood changes like depression and anxiety. Symptom 3. Megaloblastic anemia. This type of anemia causes pale skin, weakness, rapid heartbeats, and difficulty breathing. Symptom 4. Cognitive issues. B12 deficiency can affect memory, concentration, and even cause dementia-like symptoms in advanced cases. Symptom 5. Digestive issues. Some people with B12 deficiency may experience loss of appetite, constipation, or diarrhea. Symptom 6. Glossitis and mouth ulcers. B12 deficiency can cause inflammation and pain in the tongue, as well as sores in the mouth. Who is at risk of deficiency? Some people are more likely to suffer from vitamin B12 deficiency, including vegetarians and vegans. Vitamin B12 is found almost exclusively in animal-based foods. Strict vegetarians and vegans who don't supplement B12 are at higher risk of developing a deficiency. But don't worry if you're vegan or vegetarian. Just keep an eye on your vitamin levels and ensure proper supplementation. Elderly individuals, as we age, the ability to absorb vitamin B12 decreases due to lower stomach acid production, which reduces the ability to release B12 from foods. People with digestive disorders, conditions like gastritis, celiac disease, or Crohn's disease can interfere with B12 absorption. Those taking certain medications, some medications like proton pump inhibitors and metformin, can reduce B12 absorption. Vitamin B12 replenishment. There are various ways to maintain adequate levels of B12 in the body, either through diet or supplementation. B12-rich foods * the best natural sources of vitamin B12 are liver and kidney from animals, fish, salmon, tuna, sardines, beef, dairy products, milk, cheese, yogurt, eggs. Oral supplementation * available in tablets or capsules. B12 supplements are an effective way to boost levels, especially for vegans and vegetarians. B12 injections * in cases of severe deficiency or malabsorption. Intramuscular B12 injections may be necessary. They ensure that B12 enters directly into the bloodstream, bypassing the digestive system. Fortified foods * many products, like cereals and plant-based milks, are fortified with vitamin B12, making them a good option for vegetarians. Final considerations. Vitamin B12 is absolutely essential for overall health and well-being. While deficiency is more common in certain groups, it can affect anyone. Maintaining good B12 levels helps prevent disease, boosts energy, protects the brain, and ensures a long, healthy life. Make sure to include adequate sources of B12 in your diet or supplementation, and consult a healthcare provider if you suspect a deficiency. If this information helped you, you know the drill, right? Leave a like, share it with those who need to know this, and drop a comment below with your thoughts or any questions you may have. And don't forget to subscribe to the channel to stay updated with more valuable content. Take care of your health, and stay tuned for the best tips. See you in the next video.